Hello, today I'm going to be talking about the precautions and what to monitor during pregnancy when you're going to exercise. So firstly, exercise is safe during pregnancy as long as you know how to monitor your body and know what not to do and look out for certain symptoms. So if you are new to exercise, don't start with a high intensity exercise. Start with low impact exercises for about 10 to 15 minutes. If you are used to exercise, it's generally safe to continue with what you've been doing as long as there is no risk for high impact sport, that you're not holding your breath because then you'll be cutting off your baby's blood supply, as long as there's not a risk for falling, and be more careful if you're exercising at a higher altitude just due to the less levels of oxygen in the air. Remember, after the first trimester, you need to be careful when you're lying on your back, as the weight of the baby can start pushing on your blood vessels. Not for everyone, but if it does, or if you do feel dizzy or you feel like you want to pass out, you want to turn onto your side and come upright. To avoid this, rather use a small Pilates ball or a wedge just to create a little bit of an incline to shift the weight of the baby downwards. Remember that your body weight is going to increase during pregnancy, so wear clothes that don't overdress, wear breathable clothes, and stay hydrated. Don't exceed 80% of your maximum heart rate to avoid less blood flow towards your baby. And make sure that you eat enough and that you're fueled for your exercise so that you're not getting dizzy or too tired when you are exercising. Don't exercise unless your doctor has said that it's safe. So first, if you find out you're pregnant, first go for your checkup, and then you can go from there. And contact your doctor if you are bleeding, if you have severe pain, uncontrolled blood pressure, lung or heart disease, persistent headaches, or calf swelling or redness, or anything that could indicate a blood clot. And then when exercising, wear supportive shoes due to the increased laxity in your foot. Have a nice sturdy shoe or exercise barefoot so that you can feel how your foot is moving and that you can activate your foot stabilizers. Wear a supportive bra. Your breast size will increase, and especially in the first trimester, it is super uncomfortable. So there are also jumping exercises. You want to avoid them just due to the pain, most likely, but make sure you've got a supportive bra. Wear breathable clothes so that you're not overheating. And don't do any deep twists to prevent placental tearing. Monitor your heart rate or your rate of perceived exertion. So the rate of perceived exertion is a scale of 0 to 20, where you want to be exercising at about 12 to 14, which is moderate to somewhat challenging. You should always still be able to breathe and talk while you're exercising. If you're going to be using the maximum 80% of your max heart rate, so how you want to work that out is max heart rate is 220 minus your age. So I'm 30, so 220 minus 30 is 190, and 80% of that is 152. I will be putting up the age-appropriate heart rates for exercising during pregnancy. Use these if you don't feel as in touch with your body or you don't know how to monitor yourself. If you are able to monitor yourself, you are allowed to go a little bit above or a little bit below wherever you feel comfortable, as long as you don't have any severe pain, you're not too out of breath, you can still hold a conversation, you're not dizzy, and there's no abdominal discomfort. Personally, at 5 months pregnant, I'm still running. My heart rate sometimes during my runs goes up to 165, although the average stays between 155 and 160. And then I do sometimes feel a bit of pelvic floor discomfort, but more heaviness and a little bit of lower abdominal discomfort, which improves when I start to activate my core. And then later during my run, it starts to become uncomfortable again as my stabilizers get tired. And then I just stop my run and I walk home. I'm not pushing myself to finish my 5 or 6 kilometers anymore. I'm running until I feel like I've had enough, or my bodies feel like it's had enough. And then I just kind of enjoy being outside. So do what feels comfortable for you. You don't have to run. You don't have to do any big exercises, as long as you're moving and doing something to stay fit during pregnancy. Moderate exercise 3 to 5 times a week for 30 minutes is the recommended amount. Then when you're exercising, don't hold your breath. Learn to breathe with your movement. Otherwise, you are going to be cutting off the oxygen supply to your baby again. Avoid lying on your tummy after about 15 to 16 weeks or when it starts feeling uncomfortable for you. For me, this was about 17 to 18 weeks. So up until recently, I was still lying on my tummy, but now I kind of feel like I'm balancing on a ball. And don't overstretch due to the increased laxity in your ligaments, and don't do any deep spinal twists. Don't do fasted workouts. Eat before so that you can avoid hypoglycemia or a drop in your blood sugar levels. And don't exercise to failure. Exercise to a moderate level of fatigue. And avoid, if you are in your later stage of pregnancy, avoid deep squats, especially if your baby's in a breech position, as a deep squat can cause your baby to drop down into the pelvis and kind of activate the labor process. Also avoid deep squats if you've got hemorrhoids or a low-lying placenta or any prolapse, just due to the pressure that it's going to be placing onto your pelvic floor. But remember, all patients are different with the symptoms they feel and what their body experiences during this process. So listen to your own body, slow down, and do what feels good for you. Do what makes you feel stronger in your body. Then lastly, diastasis recti is something we notice a little bit more postpartum, but if the more awareness you have during pregnancy, the more you can adjust and prevent it from getting too bad. So diastasis recti is your six-pack muscles, which are lying next to each other, which as baby grows and your belly gets bigger, they will start to move apart from each other with the linea alba in between, which kind of stretches out. When we are doing stuff like crunches, it will move even further apart, which we don't want to, or we don't want it to move unnecessarily too far apart. So make sure that you've got good deep core stability, which kind of helps to retract all of this to keep that nice and stable. And after a certain time, don't go into too deep crunches. You can do a light upper abdominal crunch, but no deep crunches to really separate your rectus abdominis muscles. And then this kind of brings me to my last point, where as important as it is for your pelvic floor and your abdominal muscles to support you during pregnancy and stay strong, we also need them to be able to release during labor and kind of let baby go and help baby get out. And we do this with breathing exercises, light stretches, and light exercises, which I will discuss in my later videos, but just always keep that in mind. And yes, so that's most of the precautions for now. Thank you so much for watching. I hope this makes you feel empowered and a little bit more in control of your body and a little bit less scared of exercising, because it's got so many benefits. I really hope you enjoyed this video. Please like and subscribe to my channel so I can keep making more. Have a lovely day. Thank you.